Hey, I'm Dr. Lundquist. I'm from Payson, Utah, and I treat people who have tinnitus and hearing loss. In my personal life, honesty is something that I truly value and that's super important to me. It's something that I also bring into the work environment. I make sure I'm completely honest with my patients and that we're on the same page. And so it's something that you can definitely expect from me if you see me. So something I love to do outside of the clinic is I actually love playing volleyball. We just were in a tournament during the 24th of July weekend and had a really fun time doing it. Another thing that I've gotten into is pickleball. I love pickleball. I love playing it, and I wish I could actually play it more than I am currently. But yeah, those are just a couple things. Another thing I love to do on my spare time is to hang out with my family. I have a 5-year-old and a 3-year-old, and they definitely keep me on my toes. Patients will ask this question a lot. What got you into hearing care? The answer to that is I had a medical anatomy class in high school, and my teacher, she went over something medically, like a medical field every single week. And 1 week it was audiology. And ever since then, I've been very fascinated with the auditory system. So when I went into college, I knew that I needed to study speech therapy, essentially, or communicative disorders was my major. And so I just went ahead and did that. And I knew I wanted to go into audiology school right afterward. And so, yeah, answer that question. The reason why I love helping people with their hearing is connection. People really get socially isolated when they get hearing loss. It's just easier to do. You know, when you're not part of the conversation, you start to be socially isolated. Being able to connect people with their family again, with their neighbors, with their community has been a passion. It's really grown into a passion of mine, and I love doing it every single day. Myself, I have a hearing loss myself. I had hearing loss in college. It was actually sudden hearing loss, so it's not super common type of hearing loss, but I got some hearing loss in my left ear. And so that really just taught me that hearing is so important, and it does disconnect you to your community. And so it's been very important for me, especially after I, received my own hearing loss. I want patients to know how I approach hearing healthcare is really a multimodal approach, where it's not just about the hearing devices. You'll go to a lot of different places, and the focus is selling you hearing aids, but there really needs to be a plan in place to be able to treat the hearing loss. Yes, providing the proper auditory stimulation with hearing devices is super important, but the plan that goes along with that, making sure that the hearing devices are meeting your prescription. There's technical measurements that we do to ensure that is the case. Also making sure that they're always clean and that there's nothing that could be impeding that signal to be able to get you the correct prescription. The other thing I would say too is it's really important to have some type of oral rehabilitation program in place. Here in Timpanogos Hearing and Tinnitus, we do have that oral rehabilitation program, which really helps people to not only focus on what they can do with the devices, but strategies they can use to be able to help them hear at their very best. Whether that's looking at what you can do with your environment, what you can do, some communication strategies you can do personally, what the person that you talk with the most, what they can do to help you hear at your very best. And then of course there's this technology. The other thing that's really important is auditory training. We know that if a person is treating their hearing loss and they don't have auditory training in place, they're not going to have maximum success. So we have auditory training programs in place as well to ensure that that is the case, that they get maximum success. Patient-centered care is something that I'm very passionate about. People ask me all the time, what does that mean? Well, it means that it's patient first. What do we do to treat the patient? So our philosophy here at Timpanogos Hearing and Tinnitus is always making sure that we're on the same page as the patient. What is their goals when it comes to treating their hearing loss? And we take that and we make sure that we are really hitting those goals so we're on the same page. It's really listening to the patient, and honestly, it's a skill and not a lot of people have it. It's difficult to learn. But when you actually truly listen to the patient and are on the same page and have the same goals, then all of a sudden it becomes a relationship that you can't get anywhere else. One of the most rewarding experiences that I've ever had treating a patient with hearing loss is one where they came into the office and they were really in a state where they felt defeated. They were very isolated. They weren't able to communicate, especially in those environments that they wanted to communicate in, which is the trickier environments, the background noise, the bars, the pubs, the restaurants. And he was having a lot of difficulty in these environments. The change that I saw in this man's life was tremendous. He was able to start communicating with his family again. He was able to communicate in those environments, the bars, a lot more effectively. And he was able to connect with the people around him, his community, a lot better. And so to see him defeated and come to a place where he felt confident in those situations in his life was huge. And that doesn't happen just one time. That has happened multiple times as I've been able to treat people and their hearing loss. And that's the most rewarding part of treating people and their hearing losses, is seeing them change from a defeated state to a state where they feel confidence and able to do the things they like to do again. There's a lot of people who are nervous about treating their hearing loss. And what I would say to them is just don't worry about it. The good news is there is help out there. The fear is natural. However, the treatment and what you can get from treating the hearing loss is much more tremendous, and it can get you into a spot where you feel confidence again, and it very much outweighs the fear that can happen, because it does happen. When a patient comes to me and sits in the front of the chair right in front of me, I always make sure that I'm able to connect with them in some way. Some people want to have me talk a little bit less, and I completely understand, and I respect that boundary. But it's really important for me to understand what their life looks like so that I can help them better. So I typically ask questions about, hey, where are you from? What do you like to do? What's your favorite pastime hobby? And then we go into why they're in front of me. Why are they in the chair right in front of me? What is going on in their lives that put them in front of me? And then I will be able to take that information and help them to achieve their goals. Whether it means that they want help with their hearing, we can work on that. If they have struggles with tinnitus, then we can help them with that as well. Patients will ask me all the time, but why you? Why should I trust you? I love that question because I have a lot of experience helping people to change their lives. I went to school at Utah State for my undergrad, for my communicative disorders degree. Then I went to University of Utah for my doctorate. I worked at the VA for a little bit, helped a lot of people with their hearing loss and with their tinnitus needs. I worked at Hill Air Force Base, helped run their hearing conservation program to really help people to protect their hearing in the right way. Now, when it comes to me being someone you can trust, I'm someone you can trust because I do have the experience to help people hear better. I've helped over 100 patients already here at Timpanogos Hearing and Tinnitus, and it has been honestly a delight to help people hear at their very best and to help them change their lives. The combination of experience and the level of patient care that we have at Timpanogos Hearing and Tinnitus is truly unmatched. It's not just a number when you come into our office. We treat you like the patient that you are. We meet you at where you are coming from. And so what that means is even from the very start, when you walk into our office, you'll be greeted by someone who truly cares about you. You will be taken into the room and we will tell you exactly what we are going to do to help you hear at your very best or to help you with the problem that you came into our office with.